On behalf of our Quad City Prize team, welcome to our community. As you hear from folks involved in leading our community's work, we hope that you'll come to understand that we think regionally across organizational and geographic borders. We believe in creating health across all sectors of our community. We want to create sustainable community impact. We value experimentation before bringing ideas to scale. Our community's journey toward health is rooted in using data to shape and connect our work. One example is how United Way and other partners, such as the Community Foundation of the Great River Bend, are using data to improve high school graduation rates.
Data has really become key in how we shape the services and target the areas that we want to make an emphasis on in the social service sector. In the last 3 to 4 years, we've really utilized tools such as community issues management to hone in on where the needs are in the community and how best we can target resources.
It is important to experiment and pilot new ideas before bringing them to scale, ultimately replicating successes across the community. Increasing access to healthy foods is one issue where we've been sharing learnings across our community.
Unity Point Trinity, along with organizations who are multicultural and multidisciplinary, 12 of them as a matter of fact, are currently engaged in a healthy food access project. And we've been very fortunate to benefit from some of the healthy food initiatives in our Iowa Quad Cities. And so we're bringing that to our Illinois Quad Cities. We've also been very fortunate to have the benefit of our Quad Cities immigrant and refugee community because of the experience that they bring, particularly their agrarian experience, something that we've had to relearn in this urban gardening initiative. So we're very fortunate having those pieces together.
We create health in all sectors by valuing cross-sector collaboratives to tackle difficult challenges. Partnerships to increase access to dental and behavioral health services have built on the assets of our local federally qualified health center.
When I came to community health care in 2007, we had nearly a 3,000 person waiting list for our dental services. We have effectively eliminated the waiting list altogether, and so we've added, we went from 13 operatories to 23 operatories here in Davenport through expanding our dental program. We went from 4 dentists up to 8 dentists here at this location. So it's been a lot of effort on a lot of people's part, but we've been able to take care of a waiting list and basically make it so that people can have timely access to dental care.
During our journey toward health, we've shifted our emphasis from programs to developing policy, systems, and environmental changes. This shift is to create a culture of wellness, and it's now embedded in our community's environment.
We are emphasizing smoke-free outdoor places, including parks, as well as smoke-free multi-unit housing, which would include apartments. And that would just affect great numbers of people, so that's kind of why the policy has shifted.
Well, the YMCA has always been known for our ability to respond to community needs through programs and activities. And the challenge with that is that a lot of people start and stop programs. And with the prevalence of obesity and the overweight population, it's going to take something that's a little bit different in order to address the sustainability piece of that. And that's where environmental and policy and systems change is really going to have to help us change behavior.
Our community is joined by a river, and our commitment to health is as constant as the current on the beautiful Mississippi. Thanks for taking the journey with us today, and we look forward to showing you our community in person.